Good morning and welcome to the San Francisco Interfaith Council online briefing for community and faith partners. In today's program, SFDPH will provide a seasonal update on COVID-19, influenza, RSV, and recommended precautions. A special thanks. This San Francisco Interfaith Council online briefing is supported by a grant from the Center at Sierra Health Foundation. Thank you. The important and ongoing work of the San Francisco Interfaith Council would not be possible without generous funding from congregations, corporations, faith-based social service agencies, foundations, judicatories, and supporters like you. Help us spread the word. Visit sfinterfaithcouncil.org to learn about SFIC programming and how to become a supporter. Follow SFIC on Facebook and Twitter, and subscribe to SFIC's YouTube channel to watch all of our virtual events. A bit of housekeeping. Today's program is being recorded. For audio and video, all participants are muted and without video to minimize distraction. For chat, you can submit a question or comment by selecting the chat button at the bottom of your screen and sending a message to Q&A. Questions will be forwarded to the host and answered time permitting. For closed captions, select the live transcript button at the bottom of your screen and click Enable Live Transcription. And at this time, I'd like to welcome the director of the San Francisco Interfaith Council, Michael Pappas. Michael, the floor is yours.
Thank you, Trey. Good morning. I'm Michael Pappas, and on behalf of the San Francisco Interfaith Council, I want to welcome you to this week's online briefing for community and faith partners. Since the end of last year's COVID-19 public health emergency, news concerning the virus has not been prominent. However, COVID-19, as well as influenza, the flu, and respiratory syncytial virus, RSV, are still with us. The good news is we have effective tools to fight them. This week's online briefing for community and faith partners, hosted by the San Francisco Interfaith Council, welcomes San Francisco Department of Public Health Director of Communicable Disease Prevention and Control, Dr. George Han, who will provide an update of the status of COVID-19, flu, and RSV in San Francisco, and share recommendations on how to stay safe and healthy this winter. As we do at the beginning of each of these programs, allow me to read our interfaith statement. This is an interfaith community. Whatever our individual belief, it can be freely expressed here with no apologies. If we are invited to offer a prayer in this setting, it should be offered according to the tradition with which we identify. If we are invited to speak on a subject from the perspective of our tradition, we are free to do so without fear of offending those who come from another tradition. We come together as people of faith to learn from each other, that we might better understand the multiplicity of faith traditions in our city and in our world. It gives me great pleasure this morning, especially as we find ourselves in the midst of Black History Month and on the cusp of the observance of the birthday of the Reverend Dr. Martin Luther King Jr., to introduce friend and colleague, Reverend Dr. Jonathan Butler, who is the Executive Director of the San Francisco African American Faith-Based Coalition, an Assistant Professional Researcher at UCSF Department of Family and Community Medicine, Education Minister at Third Baptist Church, board member of San Francisco Interfaith Council, and was selected by the mayor to serve on the Homeless Oversight Committee. Dr. Butler, thank you for being with us. You honor us by your presence, and I hand the floor over to you, dear friend.
Thank you, Director Pappas. It's always a pleasure to be here, and to all those who joined us online. And as Michael has suggested, this is a trying time, but it's certainly at the cusp of the MLK holiday season. And so I want to give some reflection on a particular passage that always resonates with me in these trying times that we live in this world today, which is found in a gospel in our Christian tradition, the Gospel of Mark, chapter 12, where Jesus speaks of the greatest commandments. And he says, the two, love the Lord your God with all your heart, with all your soul, with all your mind, with all your strength. But he emphasizes the second of these commands, which is love your neighbor as yourself. And these verses encapsulate the essence of what we all should embody in the season and all the seasons of our lives, is love, compassion, and community. Now, this scripture is a conversation between a scribe in Jesus, and the scribe is asking Jesus, what are the greatest commandments, almost to test Jesus' knowledge in the Jewish law. And he responds by this. But this scripture also reminds me of this concept of the beloved community championed by Dr. Martin Luther King Jr., which reflects this interconnectedness of humanity and this pursuit of justice through love and nonviolence, which he learned from Mahatma Gandhi. It aligns with the teachings of Mark that we just heard about in terms of loving our neighbor, loving our God. And reflect on these verses in the context of the beloved community, we see this call to this wholeheartedly dedication to loving God and loving our neighbors. And this goes beyond this mere sentiment. It requires this active commitment to seeking the well-being of others, especially those who are marginalized and oppressed. And as a homeless commissioner of the city, this certainly speaks to me and the reason why I do the work that I do. Dr. King envisioned this beloved community as a society based on justice, equality, solidarity. It's a community where all of us individuals recognize our shared humanity, and we work together to dismantle the structures of injustice and inequality that so easily plagues our communities. And so this mirrors the call that's found in Mark to love your neighbors as ourselves, treating them as with the same care and the respect and the empathy that we desire for ourselves. And I know this may sound rudimentary, everyone knows this, but we certainly should be reminded of it. And as we reflect on these teachings, we should examine ourselves, examine our own actions and attitudes, the way we treat each other. You know, are we truly living in a way that reflects love for God and love for neighbors? Are we actively seeking justice and equality for all members of our community? Are we just complicit in the systems that perpetuate them? So we have to be honest with ourselves in terms of if we're going to make San Francisco a beloved community, which is informed again by the work in Mark as he writes about Jesus. It challenges us to embody love in tangible ways, that it urges us to stand in solidarity with those who are oppressed, to advocate for the well-being of everyone, and to work towards a more just and equitable society. So it's, again, not just mere words, but there are actions. And there's a text in a sermon that MLK preached about love and action. And it calls us to recognize the divine image in every person and to build a community where everyone is valued, everyone is respected, everyone is cared for. And so I encourage us as we go about these days in this trying time that we strive to live out these principles in our daily lives, that there is a level of action as required from all of us. And that's the true essence of what it means to love. So I'm certainly grateful for this opportunity and hopeful in this community that we will work together in love in action. It should be our mandate. Thank you.
Thank you, Dr. Butler, for lifting up the golden rule, which I believe transcends all confessional boundaries. And I couldn't help but think of that wonderful interfaith anthem, "Let there be peace on earth and let it begin with me." So wonderful to have you with us, and I hope you stay with us and maybe chime in later if you have any questions, okay?
Thank you so much.
We are very, very blessed. I was saying during the preparatory time together that this whole series began at the beginning of COVID as a way to be able to inform our various and diverse constituencies on all things COVID, so that our constituencies and their leadership could make informed decisions to protect those entrusted to their care. COVID has not gone away. And in addition, we find ourselves in cold and flu season, and this new RSV ailment has popped up. And so we thought this might be, as we find ourselves in the winter season, an important time to address not only the status of these different diseases in San Francisco, but how the city would have us combat them. To lead that discussion today, we are very, very pleased to welcome Dr. George Han, the Director of Communicable Disease and Prevention and Control at San Francisco Department of Public Health. In his role, he leads the department's efforts in responding to and preventing over 80 different communicable diseases of public health importance, including respiratory viruses such as COVID and influenza and RSV. Before joining the San Francisco Department of Public Health, Dr. Han served as director of the Infectious Disease and Response Branch in the Santa Clara County Department of Public Health and as an epidemic intelligence service officer and medical epidemiologist with the Centers of Disease Control and Prevention. He completed a Master's of Public Health degree at the Johns Hopkins School of Public Health, a medical degree at Baylor College of Medicine, an undergraduate degree at Harvard University, and trained in residencies in pediatrics at Baylor College of Medicine and in the prevention of medicine at the CDC. Dr. Han, we feel very, very privileged and blessed to have you with us. Your credentials speak for themselves, but in the short time that we've been able to interact, I know that our city is in good hands. And so I would hand the floor over to you to kind of speak to us about the status of these viruses in San Francisco and how the city would have us respond.
Good morning, and thank you very much for that kind introduction, and thank you for the invitation to present to you all today. I wanted to give an update on respiratory illnesses in San Francisco, covering COVID-19, flu, and RSV. And yeah, well, really pleased to be here this morning. So we'll go to our first slide. These are these three are the main respiratory viruses that we track in public health, and the reason for that is because they produce a lot of illness in the population, and they can be severe. As you may know, there are hundreds of respiratory viruses, respiratory pathogens, but the vast majority of them are either very uncommon or rare, or they are the common cold, and one gets the common cold and then is ill for a few days, and then life goes on. But the thing with these three viruses is, in particular, is that they are both common and in some cases can cause severe illness. So we don't track every single case of these three viruses, but we do tend to track trends, and we'll talk a little bit about that. Of course, you've heard of COVID-19, where it's been about 4 years since COVID came onto the scene, and then flu, of course, everyone is very familiar with the flu. RSV is Respiratory Syncytial Virus. It's also a virus that, like flu, has been around for as long as we know, but it hasn't really entered the public consciousness until more recent years. It is another virus that causes an illness similar to a cold. But babies and older adults can sometimes become very sick with RSV and need to be hospitalized. So if you look back, prior to this year, the main thing that we were able to do with RSV was to give antibodies to babies who were at high risk for severe illness with RSV. And those babies were, by and large, extremely premature babies. And so what would happen is, if you had a premature baby, they would be sure they would get these monthly antibody injections, and that would help protect them through the RSV season. What has changed is that this year there is a new vaccine that came out, and so we'll talk more about that. So in terms of sort of how the impact to the population's health and how severe these two viruses are, COVID is still the most impactful virus in terms of the number of people who get hospitalized and die from COVID, and then followed by flu, and then followed by RSV. And so RSV is kind of like a distant third. And so really the most important annual viruses that occur every year that are respiratory viruses are COVID and flu. So and I'll make one more comment about the three of these, which is that it is not easy to tell which one you may have. And so they all can produce similar symptoms in terms of the respiratory symptoms, cough, sore throat, runny nose, etc., as well as fever, feeling bad, body aches, etc. So that's one of the challenges that we have in medicine and in public health with these respiratory viruses. So we'll go to the next slide. We are currently experiencing activity for all three viruses here in San Francisco, which is normal in the winter months. And I'll talk a little bit about how we're tracking all three of these. And so we'll start with flu, because actually flu is the one that we've kind of been familiar with and have tracked the longest in public health. So what normally happens with flu is we have a flu season, and in the Northern Hemisphere, it tends to fall between, say, November and April of every year, with a peak usually in December, January, or February. And every year the flu comes back around, and every year the flu viruses change, and there are multiple flu viruses. You may have heard of flu A and flu B, and then within those categories there's all these different variations of the flu, and flu viruses constantly change and evolve, and so that's why every year we don't know exactly what the flu season will do, and that's also why we have an updated flu vaccine every year. And the way we track flu has been by looking at things like hospitalizations, and there's a network of laboratories and clinics that examine what percentage of flu tests are testing positive, and what percentage of people who are seeking care in a clinic or in an emergency room or admitted to a hospital are due to flu. And so those percentages really are what are telling us where we are in the flu season. They might be as low as 1% when it's not, or less, when it's not the flu season. And then when flu season begins, you'll start to see those numbers increase 5, 10%, 15%, etc. So that's how we've traditionally tracked flu. And so with COVID, as you remember, we used to track every single COVID case, especially in the beginning. And that was, quickly became a very monumental task. And then more recently, in the last year or two, we've started to shift how we track flu and COVID, and it does look a little bit more like flu. We're tracking things like test positivity rate, and we're looking at hospitalization rates, etc. One new tool that has come out from the pandemic is wastewater, looking at wastewater data. And so many of you have probably heard of this, where the wastewater from the sewer systems samples are taken and tested for COVID, flu, and RSV and other viruses. And we can therefore track sort of the level of the virus in our wastewater. And the reason this is possible is because it turns out that we excrete virus in our bodily wastes. And so that's ends up into the sewer systems and into our wastewater. And it is actually a pretty decent way of looking at what's going on in the community when it comes to levels of virus and activity levels, et cetera. But I will say it is still a relatively new method. And so there's still a lot that we may not completely understand. And so, you know, one particular question is, can you compare wastewater levels from one year to another? You know, when the virus changes, you know, does that change kind of the calibration of detections that we have in looking at the levels? And so with that caveat, I will mention that, yeah, we now are looking at wastewater as well. And so for these three viruses, I'll talk about what is currently happening in our area. COVID-19 is definitely on the rise. And so you may have been hearing about that. And so we're at fairly high levels of COVID. The interesting thing about that, though, is that our hospitalizations have not quite risen in the same way. And so that's good news. And that's probably due to a combination of the fact that folks have been vaccinated multiple times, and that you know, almost everyone has been infected at some point. And so that helps with decreasing the severity of illness. It may have something to do with the current variants of the virus that circulate, but we don't know that yet at this point. For flu, we did see some increases in flu in November and December, but I would say that flu is currently fluctuating. In California, it is elevated, and it has been increasing across the country. So it would not surprise me if flu increased during this month, in the coming weeks here, and it could be, you know, as soon as this week. And so that's the status for influenza. And then RSV, we did have a pretty big increase in RSV over the fall, and that has decreased, and it may be increasing again right now. So we'll be continuing to track how RSV works. One more thing I'll mention about RSV is, since I'm a pediatrician, is RSV has traditionally been known as a virus that is very common in our young children. And so, you know, virtually every baby gets RSV by the time they're 2 years old. And so it's very, very common among babies and toddlers. And then it produces problems in, you know, the really premature babies, and then when it spreads to older adults with who may have other medical problems. Okay, so we'll get to the kind of the vaccine aspect of things. And so as you know, there have been several rounds of COVID vaccine, and this past fall was considered an updated COVID vaccine, not a booster. And the reason for that is because it has been changed from the original formulation to match sort of the latest COVID variants. And so what is planned to happen, and we believe has already begun as of last year, was we'll have kind of an annual COVID vaccine, similar to having an annual flu vaccine that comes out in the fall or the late summer. And you know, that'll just be part of our landscape moving forward. So the numbers that we have so far for this year's new COVID vaccine are that approximately 26% of San Franciscans have received it. And this compares with favorably with national and state vaccination rates. So national rates are lower, and state rates, I believe, are even lower than that. I think maybe around 12% of Californians are vaccinated with the latest COVID vaccine. And so We are doing better in San Francisco, even though it's lower than we have experienced with the prior rounds of COVID vaccine. And that our 26% includes 16 to 18% among Black, African American, Hispanic, Latino, and Pacific Islander populations in San Francisco. So one of the things that we definitely are trying to do is continue to encourage folks to get COVID vaccine, though it is challenging, given the vaccine fatigue that that a lot of folks have been reporting, or that we've been hearing about, and maybe some misinformation that hopefully I can help clarify for you today. So we can, and then I'll just mention, of course, the COVID vaccine as well as the flu vaccine are really the best ways to be protected from serious illness from COVID and flu. And so on the next slide, we'll talk about the recommendations. People 6 months and older should get both of these vaccines. And so the good news is it is a really straightforward recommendation from the CDC. And that is really done purposefully to simplify the messaging that we can give to everyone. The recommendation is simply everyone who's at least 6 months of age should be getting these vaccines every year. And in particular, we talk about people with chronic medical conditions, like really common ones, asthma, diabetes, heart disease, etc. And then the very young, and then older adults. As well as pregnant women are all at higher risk, and so they should all get these vaccines for sure. But really, the recommendation is for everyone. And then in terms of RSV, that is a new vaccine that just came out this past fall. And so there is not currently a universal recommendation for that. So what the CDC has said is that adults 60 years and older and pregnant people should ask their healthcare provider about if RSV vaccine is right for you. And for pregnancy, that should be done between weeks 32 and 36 of pregnancy. And the reason for that is because that then gives the mother time for development of antibodies that they can pass on to the baby, so that when the baby is born, they'll have antibodies to RSV already and will be protected for at least a period of months. So it's really important for those who are pregnant to get this vaccine during RSV season. And of course, RSV season is a specific during the winter months. And we also can talk about the insurance. And so all of these vaccines are covered under insurance, and they should be covered without copay, though I know some insurances have been struggling to implement that with COVID and RSV. But they are also, in terms of COVID at least, provided for free through a federal government program that's called the Bridge Access Program. And you can visit vaccines.gov to find a location. And we at SFDPH have also been providing free vaccine, COVID and flu, throughout this fall and this season. And I do get a question about, whether or not it's too late. It is not yet quite too late, though. We do want to emphasize that the best practice and what we recommend is for people to get these vaccines, COVID and flu, by the Halloween. That's kind of like a good marker, is you should get them by Halloween. You can spend November to catch up, but really you want to get them before the holidays, because this is when, the holidays are usually when the viruses really come up really high. So but if you have not yet been vaccinated, and if you haven't gotten COVID or flu yet, then it's not too late. Go ahead and get it as soon as you can. One other thing I'll mention about RSV that's different than COVID and flu vaccines is it is not currently an annual vaccination. It may be that you only need to get the RSV vaccine once, and that might be the recommendation, but we'll have to see. Since it's a new vaccine, people need to kind of study it to see how long the effects last. But it is a good vaccine in terms of its effectiveness. So currently, it's just the flu and COVID vaccines that are recommended annually. All right, well, we can move to talking about testing. And we all know about testing at this point. We've probably all used these rapid at-home test kits for COVID. That was a great achievement. The development of these rapid tests that were pretty easy to use. The federal government continues to have the program where you can order COVID tests, covidtest.gov, and get up to free at-home tests this past fall. And so if you haven't done that, you can still do that now and have it delivered for free by the Postal Service. Free test kits have also been made available by SFDPH at different community sites while supplies last, and including at our public libraries here in San Francisco. You may have heard about that, and so that's another option. And many insurances continue to provide free at-home tests, and so you can find out more from your insurance company. It is important to test, and the reason for that is because when you test for COVID and you find out that you're positive, that allows you to take the important next step, which is to get treated. Treatment with, for example, Paxlovid is great because it allows you to decrease your chances of getting really severely ill from COVID, and decreases your chances of hospitalization and of course, death. So the important thing with the treatment, which is, as I mentioned, pills, is that you start them as soon as possible after you start feeling sick. And so the maximum amount of time you're allowed to have between starting to feel sick and taking the pills is 5 days. But actually, the sooner you do it, the better, because that prevents the illness from potentially getting worse. Some people have said, "Oh, I just want to wait. It's not so bad. I want to wait until I get worse if I get worse, then I'll start taking the pills." But that's actually not what's recommended, because the pills are more effective when you take them when the illness is still mild. Once you get severely ill, actually, you can't take the pills anymore. You had to take you'll be in the hospital and you'll be doing IV medications at that point. So the great thing about Paxlovid is it's a prescription medicine that helps prevent, really decreases the likelihood of getting severely ill. And so the next slide, how do you get that treatment? If we can go to the next slide. Yeah, there it is. And so, insurances will cover it, and so contact your provider. But if you don't have insurance or a provider, California, fortunately, the state public health department is still offering free COVID-19 medicines via Sesame Care. So there's either a website or this phone number to make a free phone or video appointment with a healthcare provider who can then prescribe you Paxlovid. And this is useful also, even if you do have insurance, but you're unable to reach anyone within 24 hours, because as I mentioned, that timing is really of the essence. Now, moving to flu. So there's also a treatment for flu. Tamiflu is what most people have heard of, and it's also a prescription medicine. It's also does similar things in terms of decreasing your likelihood of getting severely ill. And it's also important to start taking Tamiflu quickly. And so what it says is, you should start the medicine for Tamiflu within 2 days. And so it's even quicker than for COVID and Paxlovid. And so what this means is that really you want to know what you have as soon as possible. You want to know if you have COVID or flu or something else. And so one strategy to do that is you can, as soon as you start feeling sick, take a COVID test. And then if it's positive, you have COVID and you can go down that route. But if it's negative, you could then call your doctor and say, hey, can I come in and get tested for flu? And then see what they say. And if they say they recommend it, then you can get tested for flu. Unfortunately, there's no at-home test for flu. So that's the key difference, is that in general, you would have to go to a doctor's office in order to get tested for flu, and then get the treatment from there. So with Tamiflu, it is recommended for these groups, children younger than 2, adults 65 and older, pregnant people, and of course that category that we've been talking about, people with a variety of health conditions, and that can mean asthma, diabetes, heart disease, a lot of different things. And so it's best to kind of talk with your doctor. I didn't mention, by the way, these are the same groups that should get COVID medicine. And I would say for COVID, the indication is even broader. Pretty much a majority of adults probably qualify to get COVID medicine because they have one or more of the many conditions that qualify someone to receive COVID medicine, in Paxlovid in particular. Even things like physical inactivity count, or anxiety, depression, being overweight. I mean, we're talking about really common conditions that would qualify you for getting treated for COVID. Oh, and so for RSV, there's no outpatient treatment for RSV, and so the best thing there is prevention. And in the hospital, if it gets severe, they would take care of RSV there. So in terms of other ways to stay healthy, so stay home when you're sick, try to avoid being around others who are sick, and then wearing a mask when you're in crowded indoor spaces. Definitely this is virus season, respiratory virus season, so wear that well-fitted mask, whether it's like a KN95, KF94, N95, etc. That's really important, especially if you're in an older adult or in a group that is a little bit, have one of these many medical conditions. And think about ventilation. So, the same things still apply, where, improving ventilation helps, whether it's having things that are outdoors, events that are outdoors, or if you're indoors, cracking open some windows, having some HEPA filters on. I think everyone got very familiar with HEPA filters, both because of the pandemic, but also because of wildfire smoke. And so that works in the same way. Those are the same filters to help filter the air. In terms of, we also recommend hand washing, and that's not on here, but hand washing is still effective for flu and RSV. It may be effective also for COVID, but COVID is really airborne, and so that's why the masking and the ventilation is really most important for COVID. But hand washing is still good to prevent flu, RSV, and all the other respiratory viruses. Again, flu and RSV also transmit through the air, and so wearing a mask and improving ventilation will also help prevent flu and RSV. So those are the sort of the primary ways to stay healthy aside from vaccination. All right, and we're nearing the end here. So this last bit is about, California COVID-19 isolation guidance is being updated this week. And so it's a change where they're saying that the formal isolation period, the recommendation is really, it's coming in line with flu and all, other respiratory illnesses. So what we've always said for if you have the flu, or if you have fever and cough, let's say, is we always recommend that folks stay home until you haven't had a fever for at least 24 hours, not 23, but 24 at least, and without taking something like ibuprofen or Tylenol, and that your symptoms are mild and that they're getting better. So that's what the updated guidance is now saying, is kind of bringing COVID into the realm with the other recommendations that we've traditionally had. However, you should still mask, and for at least 10 days. And so that's the main thing to keep in mind, is that even though you can go out, you do need to mask for the 10 days, unless you have taken 2 negative tests in a row. And then the other thing is to make sure to avoid contact with people who are at higher risk for severe COVID for 10 days. And so, that does include all the same folks that we've been talking about, but really this is talking mostly about elderly, people who live in congregate care facilities, people who have immunocompromising conditions, etc. And I think this is a great place to stop and see what questions we may have. Thank you.
Thank you so much, Dr. Han. And again, we would invite our listening audience to, of course, ask questions. We did receive one thus far, and that, hold on just a moment. I have to scroll up. Yes, it's from Martin Vanderlaan. And he says, it seems to me prudent for all assisted living and rehab facilities should have visiting nurses that would offer all vaccinations to their residents. Can SFDPH require or at least facilitate this? Also, some people are homebound. Can public health nurse visit the homebound to offer vaccinations?
I wish we had. I mean, I'm just speaking like my personal. This does not represent any official views, but for me personally, I wish we had a system of medicine that covered everyone. I really do. That would be excellent for public health, and that our entire country's medical system and infrastructure were set up in a way that would allow for this kind of amazing vision of giving vaccines to people where they are. Our medical system just isn't set up that way. There are lots of hurdles and regulatory reasons, and I don't want to go into all the details. But in terms of the homebound, we do still offer COVID vaccination to some homebound individuals. What we've been trying to do is really work with their healthcare providers and insurance systems, so that those providers will take care of their patients, right? Because pretty much everyone who is homebound has Medicare, Medicaid, or a commercial health insurance, or is a member of a health plan, and so that's what we're moving towards, is trying to work with all of them to ensure that they take care of their members. But we do, in the meantime, we have gone out and offered COVID vaccination. In terms of congregate care settings, for COVID, they have been working with pharmacies to continue to provide vaccination, so that's good. And so that's how the majority of, for example, skilled nursing facilities have gotten their residents vaccinated, was through partnerships with pharmacies, retail pharmacies coming in and vaccinating their residents.
From my dear friend Roma Guy, can you share more specifically how you are tracking and investing in vaccinating highly vulnerable populations such as Black Latinx?
Yes, so we do have a tracker on our website, and we receive data from the California Department of Public Health. So the way it works is that there is a California immunization registry, and every healthcare provider who provides COVID vaccine is required to enter data about the vaccines that they're giving into that registry. And then that data then flows to all the different jurisdictions in California. So that is how we're able to track vaccinations received, including by race and ethnicity.
Excellent. In just a moment, I'd like to invite, and Trey, would you bring Dr. Butler back into the fold here so he can ask a few questions? But we have two others in the meantime. One is, can I fly if I have any of these viruses? And the second is from Denise Jacques. Does SFDPH provide RSV vaccinations, and where, if unavailable, through one's primary care provider?
Thank you for that question. So there's, as you may know, there are several different components to SFDPH. So one component of SFDPH is our system of primary care clinics. And so that is a place where you can get RSV vaccine, by talking to your provider and asking if it's right for you, and then they can provide it. It is not included in my division that I work in, which is the Population Health Division. And the reason for that is because, it's not a universally recommended vaccine. You have to talk to your doctor and find out if it's right for you. You can, of course, also go to the FQHCs and other community clinics, the federally qualified health centers. Many clinics have begun to get RSV vaccine. And, you can kind of call the clinic to check if they have if they're giving RSV vaccine out. And pharmacies also are able to give out RSV vaccine, but it would probably be good to, if you are able to talk with a healthcare provider, and then call up a pharmacy.
And on the flight issue?
What was the flight issue? Sorry, I missed that.
Can I fly if I've got any of these COVID?
Oh. Yeah, I mean, there's no one who's checking, as you know, but I will say it is quite uncomfortable to fly when you're ill, and so I don't recommend it.
Dr. Butler.
Yes, thank you, Dr. Hunt, for the presentation. I have two questions. One is about just clarification. I noticed you didn't say the word booster, and so my question, should we anticipate taking all three vaccines annually? How frequent should we think about it, and just preparation for members of congregations so that they can be aware of what's to come?
Yes, and that's a very important distinction. So these are for COVID. They're not. We are no longer having COVID boosters. And originally, when we used the word booster, it was meant to signify that we were getting the same vaccination again and then again and again. And so it's no longer the same vaccination. It's no longer the same vaccine because it's been tailored to the latest COVID variants. And so we do look forward to an updated, what I'm calling an annual COVID vaccine, which aligns with what we have been doing for flu for forever, which is having an annual updated flu vaccine. So what I would anticipate is every fall to get those two COVID and flu vaccines, and you can get them at the same time. And that will set you for the season. So the wild card is RSV. And so I this is just my own personal opinion, but it could be totally wrong. We'll see. Like, I don't anticipate that RSV will become an annual vaccine. We will see what it ends up being, if it's a one-time vaccine or if you might need to get it every few years, but I don't think it's going to be every year. So I still think, so it is good to get RSV vaccine next season, let's say, if you haven't gotten it this season. But probably you won't have to get that every year. So we're really still thinking about flu and COVID, excuse me.
Great. Thank you for the clarification. I know many folks are hesitant of taking multiple vaccines throughout the year, but only one is required as of now. So that's great to know. The other question is about sort of it's sort of a health equity lens. So we know that Black African Americans, Pacific Islanders, et cetera, have a low vaccination rate. What worked during the pandemic is being able for churches to have vaccination clinics just for easy access, especially for our seniors. And so this is part advocacy and, helping. Maybe you could help us in advocating to the DPH leadership of the importance of partnering with especially Black churches and ensuring that our members have access. We see them every week on Sunday. They ask about them. They prefer to be vaccinated in a place where they can trust health officials, they can trust the community. And so I'm just wondering if that's something top of mind for the department. And if not, can it be? And what ways can we help in making sure that we move to that direction?
Yeah, no, I definitely, that was a successful strategy in the pandemic, and I would love to see that continue. And I know it has continued so far, and it may not be able to continue at the same sort of intensity as in during the pandemic, but it would still be great, in my opinion, to be able to do that to at least some extent. We might need to do something where we consolidate and have fewer events with more participants. I think that would be more in terms of like effectiveness and that kind of thing. But I agree that that's something that I'm hopeful for. I personally am trying to keep on the table. So as you know, that there are lots of stakeholders and decisions that need to be made when it comes to budget, et cetera. But from my perspective, I think it's a great strategy.
To piggyback on that, and as Dr. Butler knows, ask and you shall receive. We have been for the last 35 years hosting the Interfaith Winter Shelter. And last year and again this year, we've had pop-up vaccine clinics at our shelter sites. And I was just thrilled. We got the statistics back from St. Mary's just a couple weeks ago. And the proportion of people, it's voluntary, who accepted to do it among our homeless clients was significant. So if we can be of any assistance to you, Dr. Han, in getting this to vulnerable populations, know that the Interfaith Council is here and the African American Faith-Based Coalition is here because I think it's significant. They say confession is good for the soul. I have some of these rapid tests that are past expiration. Can I still use them?
Yes, so that's a great question. And so, the official recommendation, of course, is to use unexpired tests. But that is sometimes challenging for a couple of reasons. One is you might have an expired test right here, and you might just want to use it, and that's so that's actually a common reason that folks use them. But the other reason is because most of these tests have an expiration date that's printed on, and that's not their real expiration date, because the FDA has extended the expiration date once or even twice, and so it's really a little bit of a challenge to look that all up, right? And so, yes, I mean, your two options are you can go out and try to find one that does not appear to be expired, or you could opt to sort of use that test. And the way you can tell if it is still good is if the C control line still pops up. So you know that if you're negative, that C control line will pop up. And if you're positive, then you'll have the 2 lines that pop up, right? And so if that C line pops up, the control line pops up, that means the test is good and that you can rely on that result. But if it doesn't, or if it's like faded, then I would take the test again.
Okay. COVID was part of our collective experience as a people for 3 years, and it changed and conditioned our behavior. I'm wondering, and I recently had spent some time over at Kaiser, both at the hospital and the medical center. Everybody was wearing a mask. Out in public, not so much. What are the recommendations for masking currently?
That's a great question, and I received a question that's similar to that in a direct chat message to me. So yes, the recommendations are well, as I kind of alluded to earlier, I think I would recommend wearing a well-fitted mask when you are in a relatively crowded indoor space. And so, what does relatively crowded mean? I mean, I think it depends on the number of people and how big the space is. And so I think a lot of people probably have a good sense of that at this point. I mean, certainly I would be wearing a mask when riding public transit, on planes, at airports, etc. Like that's a definite yes. And in other places, I would say that would be a good idea as well. So certainly healthcare facilities, skilled nursing facilities, congregate care, shelters. I mean, there's churches. I mean, unless it's like a really large sanctuary with, not too many people like in it. But, I think now is a good time to be wearing the masks. And in terms of, the requirements have largely gone away, except for in sort of the healthcare settings. And skilled nursing facilities and that kind of thing. So, but that doesn't mean that it's not recommended still. And so I definitely would be wearing those KN95 masks, let's say, the well-fitted masks, the higher quality masks when out in an indoor space. And that can, include your large gatherings that are private gatherings, in your homes or whatnot. And you can also take those steps, like I mentioned, to improve your ventilation.
I'm just curious because, I know so many people who are getting COVID, and some of them for the very first time. What do you attribute it to, at this stage in the journey?
Yeah, that's the question that everyone's trying to answer. And I think that I can only kind of speculate and kind of talk about what I've read from what others have said. But we know that the COVID virus and the viruses, I should say, because there are multiple variants of the COVID viruses out there, they continue to change and evolve. And so because of that, they're able to get around the immunity that we've built from the previous vaccines and from the previous infections that we may have gotten. And so that's why COVID continues, is because it keeps changing. And it's not going to stop changing. I think that's a key point. So right now there's, you may have heard about the latest variant. I think it's called JN1. And because it's a different variant, we don't have as much immunity against that particular variant, and so it's able to cause people to infect people and cause illness. And so, the different variants are going to keep evolving, which means people are going to keep getting sick. But interestingly, it doesn't appear to be a constant kind of thing, right? As we've seen throughout the pandemic, it goes up, it goes down, it goes up, it goes down. And so, it is probably prudent to kind of have a general awareness of like what's going on. And, one of the best measures is exactly what you said, which is when you start hearing about your friends and associates and colleagues getting COVID, okay, it must be going up. And so like, I need to take my precautions, and so that's a great way to kind of informally know without like having to look at the news or whatever.
I want to be very respectful of your time. We've come to the end of the hour. I'm just wondering, what role do you think that faith leaders have in helping people stay healthy during COVID, flu, RSV season?
Yes, thank you for that question. And, I think this is a great way for me to thank all of you for your participation in this, work and in this meeting series over the last several years. Faith-based communities and faith communities are really critical to getting the word out on what is really protective for people's healths and for our communities. The communities that you're in, they are built on a lot of trust, and as we know, that has been challenging at many points during the COVID, and in public health in general. Trust is so important, and so when you have trust, that's most of the battle, I think, because there are actions that we can all take to protect our own health and to help protect each other. And chief among those actions are getting the vaccines that are recommended and wearing those masks when you start noticing the virus is going up. Washing your hands, staying home when you're sick. I mean, this all requires community effort and participation. And so when the whole community is able to come together and do all of these things, that really helps protect the community, especially the most vulnerable among us. And so I really want to express my gratitude for your important work, and to continue to ask for your help in spreading the message, and the recommendations that we've been talking about today of, vaccination and masking and, getting tested and treated, because that will help prevent you from getting severely ill. So these are all messages that you don't hear necessarily every day. And so when they come in the setting of a faith community, I think they can have a real impact and actually improve the lives and health of all of us in our communities.
Dr. Hen, thank you very much. And on that note, we will be distributing the recording link, your slide deck, and any other links that would be of help to our 5,600 e-subscribers by day's end today, and encouraging them to share it with their communities. We also want to thank our listening audience for being with us and for the good questions that you all asked. And we ask you to stay tuned for future programming. This brings to a conclusion today's online briefing for community and faith partners. Have a beautiful day.
Thank you.